Hi everyone, I'm Dr. Ashley Woyak. I'm a naturopathic and chiropractic doctor in the Madison area. One thing that makes our clinic different than most is we practice functional medicine and functional neurology. A lot of the patients that we have come in and ask me questions are regarding thyroid. They're wondering, why am I still having thyroid symptoms when my doctor has put me on Synthroid, levothyroxine, hormones, you name it, I'm on some medication, yet I'm still gaining weight, I'm fatigued, I'm depressed, my hair's falling out, all the symptoms you can think of with thyroid. So what makes our clinic different is we look at why you're having thyroid symptoms and thyroid disorders rather than just throwing a medication on it. So there's literally dozens of ways your thyroid can go wrong. The first one we're going to talk about today, and I'll make videos on all of them so you can get educated and you can figure out what might be going wrong with you, but the one we'll talk about today is in your brain. So that's where thyroid hormones start out. You literally in your brain have your hypothalamus and you have your pituitary gland. So those are both in your brain. What happens is your hypothalamus, and it has a paraventricular nucleus. It's these neurons that released thyroid releasing hormone. That tells your pituitary to make TSH, thyroid stimulating hormone. I'm sure most of you are familiar with that. And then that tells your thyroid gland to make T3 and T4. Among this, the pituitary does a lot more with hormones, but just right now we'll talk about how it affects your thyroid. So what happens then is based on your amount of T4, T3 in your system, that goes back to your thyroid, your brain, your paraventricular nucleus, and says, okay, to make more or less to your pituitary gland. So that's in your brain. So what could happen here? Your paraventricular neurons, the nucleus there needs proper amounts of certain neurotransmitters. The two big ones are serotonin and dopamine. If it does not have adequate amounts of either of these neurotransmitters, that paraventricular nucleus cannot make thyroid releasing hormone, can't make enough adequate amounts to tell your pituitary to make TSH and then to tell your thyroid to make T4, T3, so it can do its job. So you might be asking, well, why would I have issues with serotonin and dopamine? So if you have other symptoms like depression, you're not enjoying things that typically make you happy, you're not sleeping well, you can't focus, a lot more symptoms, but if you have anything like that, you're probably having an issue with these neurotransmitters. So what's going on there? The most common reason that you might not have adequate amounts is blood sugar dysregulation. So we like to call that dysglycemia. You either have too much blood glucose in your system or not enough. So insulin resistance or hypoglycemia, that can throw off these levels to not make enough. The second really common one is B vitamin deficiencies, whether it be B6, B12, and other ones. Either you're not taking in enough through diet or supplementation, or you're actually not able to methylate your B vitamins so you can use them to make these neurotransmitters. So we are able to test for that. We can look at if you have an MTHFR defect, which that's very common people, so getting the proper form of B vitamins in your system and addressing dysglycemia so that you can do the proper pathway to make proper thyroid hormones. You guys, this is just one way that thyroid can go wrong. This is in your brain. There are dozens of others that we'll talk about. Okay, I'm Dr. Ashley Woyak. Thank you.